Nursing staff across the NHS have voted to strike over pay and patient safety concerns, a historic step that will fuel fears of widespread disruption across the UK public sector this winter. Announcing the result of its first ballot on industrial action since its foundation 106 years ago, the Royal College of Nursing Union said staff at many of the country's biggest hospitals had voted to take part in a strike. However, other hospitals had narrowly missed the legal turnout thresholds to qualify for action, the RCN added. The threshold was met in 176 employers out of 311 where ballots had been held. Industrial action by RCN members is expected to begin before the end of this year, although the mandate runs until early May. RCN General Secretary and Chief Executive Pat Cullen said, "Anger has become action." She added that nurses would no longer tolerate a financial knife edge at home and a raw deal at work. The RCN decision sets the stage for an unprecedented wave of industrial action in the months ahead. Ballots covering more than 1 million public sector workers, including the RCN's more than 300,000 members, are set to conclude over the coming weeks, threatening to affect the running of schools, hospitals, and railways. Unison, the union that represents more than 400,000 NHS workers across England, Wales, and Northern Ireland, launched its ballot 2 weeks ago and, if it receives a mandate for industrial action, could call strikes in the new year. The RCN has been campaigning for a pay rise of 5% above inflation, arguing that this was needed to address a crisis in NHS recruitment after a decade of real terms pay cuts. In September, UK inflation reached 10.1%, its highest level for 40 years. The impact of the strike on an already severely stretched NHS may test public support for prolonged action. It could lead to operations and appointments being cancelled, potentially hampering efforts to clear record queues for hospital care. However, unions argued that pressures have become so acute that many parts of the health system were already operating with staffing levels close to the minimum that would be in place during a strike to ensure patient safety. The state of pay in the NHS has become frankly laughable. Despite the risks and casualties from the pandemic, the government seems to be taking the goodwill of the NHS for granted. They're simply not listening, and with the buying power of each hard-earned pound diminishing, it seems like the only option is to withdraw labor. This is not just about wanting a pay rise for nurses, there should be an equitable and inflation-busting pay rise for all colleagues, regardless of their profession and pay grade. The 5% pay rise is not enough to maintain a standard of living. There are concerns about the impact on the already dubious quality of care patients are receiving, with the cuts to services in the last decade. Even working to rule is hard to justify to yourself when you're used to eating while doing paperwork, putting off bathroom breaks to complete jobs, and leaving late almost every day because you can't let your patients down and don't want to burden already overstretched night staff. The strike will come as the NHS faces its worst-ever staffing crisis while it is still recovering from the hit to services during the COVID pandemic. The much-cherished British institution, which has provided healthcare free at the point of use since 1948, is now dealing with a record 7 million patients on waiting lists for hospital treatment. Accident and emergency departments are also under strain. Waves and waves of crisis keep hitting Europe, and this may be the biggest after the energy crisis. Don't forget to hit the like button, subscribe and turn on notifications. Thanks for watching.